CIT stands for Crisis Intervention Team. A CIT officer is an officer who's undergone not only a 40-hour class on mental health training, but has also demonstrated the ability to de-escalate crisis situations. I think it's the only training outside of the academy that officers get that really focus on mental health, understanding mental health needs. Sometimes officers respond to law enforcement type cases that require investigation, but there are also a number of cases that we respond to that involve crisis stabilization. Someone should call the dispatch center either through our 911 number or our non-emergency number, whichever is appropriate, for those crisis stabilization type cases, domestic disputes, even domestic violence, or even some of those other cases that outliers like our welfare checks that we do quite regularly. Somebody's at a really low spot in their life, and the police are called just to check on the person. Our Diversion First program is a huge, multifaceted, multi-agency collaboration to keep people with mental illness out of the criminal justice system. And not for every case, but for those cases that there's really no true effect on the community. I think everybody feels that those folks would be better served through mental health treatment instead of going through the criminal justice system.